Well, joining us now for her her explanation of this new variant of COVID and what it means for people in this country, Dr. Soumya Swaminathan. Thanks, Dr. Swaminathan, for being with us. You know, the statistics at this stage are perhaps inaccurate because the level of testing is very low in India. But there is one data point that we do have, which is that 30% of all pneumonia cases being tested in Kochi are turning out to be COVID positive. In other words, the positivity rate is extremely high at this stage. Is this likely to be the case in other parts of India as well?
Good evening, Vishnu, and thanks for bringing up this topic again on your show. We've been through this many times before, as you know, over the last 4 years. And this is what we expected, and this is what WHO had talked about. Even when Dr. Tedros announced the end of the global public health emergency in May of this year, 2023, he did say it is still a global health threat. And that's what we're seeing now. We're seeing a new variant, the JN.1, which is a subvariant of Omicron. So hopefully it behaves like Omicron, which was relatively mild. But what happens is that every new variant gets some properties of being more transmissible. It's able to evade or avoid the antibody responses that we already have in our system, and therefore it's able to create these waves of infection where it infects people who've already been infected before. So what we're seeing now is a surge in this particular variant globally. It's been first detected in August, but over the last couple of weeks, many countries have reported that it's the fastest growing subvariant, and the WHO calls it a variant of interest because it has certain mutations that might make it more transmissible. Now, coming to India, as you mentioned, we've just started increasing the testing. So over the next few days, I think we will see more data coming from many states. Right now, it looks like a few states like Kerala, Karnataka, Maharashtra, perhaps Tamil Nadu, they're reporting an uptick of cases and this high positivity. Now, the positivity rate also depends on who you're testing. And so if you're testing sick people who've been admitted to the hospital with pneumonia, then there are a few possibilities that, and COVID is certainly one of the possibilities or the differential diagnosis. And so you're going to pick up more as you start testing more and more people. And I think at this point of time, probably the testing is going to be limited to people who are sick, who are presenting to the hospital, because there's so many respiratory infections going around, that it's impossible to test every person who has a cough and cold. But this type of strategic testing is very important because it will tell us how much is influenza, how much is COVID, how much is other viruses, because obviously the treatment and management will differ.
Right.
And what the genomic surveillance will then tell us how much of COVID is JN1 and maybe other variants are circulating as well.
So, ma'am, is it correct, therefore, that this has now entered the community in parts of Kerala? Therefore, it's in terms of progression of the disease, it's, one step further from being something that's essentially contained.
So, yes, I think by the time that, we detect these variants, they're usually already spreading in the community. And so it's likely that it's everywhere, and the more we test, the more we're going to find. In fact, wastewater surveillance being done in many countries suggests that this is going to become the dominant variant globally within the next week or so. So I think it is to be expected. I think what is important is for us to keep a close eye on what the clinical manifestations are. And at the moment, it doesn't appear that it's causing any more severe illness than, previous Omicron variant. The WHO has not said that this poses a special public health threat. However, I think what happens is if you get 1,000 cases, there will be a percentage of people, even if it's 1%, who get very ill or in the hospital. If you get 100,000 cases, that many more people are going to get very ill and in the hospital, particularly those, over the age of 65 and those who have other comorbidities. So it's a good idea to be prepared, to take precautions so that we can at least protect those who are at highest risk of getting sick and prevent them from getting pneumonia and into the hospital.
So, ma'am, that's such an important point. We'd taken a lot of steps in India oxygen plants being installed in hospitals, more ventilators, more devices, more basic care. Do you believe that whatever we had set up to deal with the emergency then needs to be reactivated? Because we are a huge country, and it just statistically, if you have a large number of infections, there will be that transfer of cases to hospitals.
That's right. And I think because it's a season with many respiratory illnesses, it's even more important that hospitals be prepared, because the majority of these infections, even if they become pneumonia, they can be treated. We know how to treat COVID now. We're at a very different stage than we were in 2020. We know how to treat influenza, pneumonia. We know how to treat different pneumonias, mycoplasma, whatever infections are going around. So I think the preparation of the hospitals is important. I think mock drills have happened in many states to test the response as well as to test the adequacy and functioning of the oxygen, the ventilators, all those things that we had prepared. So in a way, it's a good test for our system to do this once in a while, to be absolutely ready and prepared and not have any nasty surprises when we actually need to use all of those things that, we have invested in. So I believe that we're very well prepared, but that every state must exercise these precautions as well as mock drills, and make sure that even in remote parts of the country that we're able to provide people who need oxygen, they should get oxygen. If they need intensive care, we should be able to take them to an intensive care unit. And it's not only in the cities, but I would say especially in the rural areas, it's even more important to test our systems.
Do the vaccines still work, Doctor? Is there a case for a third dose for people in India?
So from what we are seeing around the world, I think vaccines are still working. It's very remarkable that they're still providing high degree of protection, especially against severe disease. Otherwise, we'd be seeing much more severe illness. So I think the vaccines are working. But again, for those who are very old, for those who have poor immunity, there is a possibility that their immunity would have waned, that boosters might be needed at some point. In many parts of the world, they're using an updated vaccine with the XBB 1.5 variant. I think we have an Indian vaccine also, which is an updated vaccine, an mRNA vaccine that potentially could be used as a booster. So I think we need to look at our data very carefully and then, take a decision on whether boosters are needed, for whom, where, etc. And the government will take, cognizance of what's going on and make those decisions as needed.
Ma'am, a lot of people now, perhaps because that fatigue has still not left our system, we went through hell a few years back, now turn around and say, oh, but COVID is just like a common cold, it's no big deal. How would you respond to them?
Very different from the common cold, Vishnu, not just because of people getting severely ill with acute COVID pneumonia, but also because of the long-term effects of COVID. And I think we have enough data now from around the world to know that people who've suffered from COVID, and particularly those who have repeat infections, are more likely to get, for example, heart attacks, strokes, diabetes, dementia, depression, mental health problems, prolonged fatigue and muscle pain, inability to go back to their usual state of functioning. This is the big difference between a common cold and COVID. So I would say let's not take it lightly. If you can avoid the infection, much better to avoid it than to get it and risk the after effects of long COVID. I think very recently ICMR also came out with their data, and there have been data from many cohorts around the world which show that the risk of all of these what are called the diseases that are caused by high inflammatory markers in the blood, like heart attacks and diabetes and brain disease and so on, there is a much higher risk. So why add to the already existing risk? And we are a country with high comorbidities. We're a country with, more than 40-50% of the adult population has either hypertension or diabetes or both. And so we really shouldn't be taking any additional risks. So I think masking up, if you have any vulnerability, masking up when you're in a crowded place, if you're traveling in a plane, or if you're sitting in a very closed environment with lots of people for a prolonged period of time, and of course in health facilities, everybody masking up is a really good idea.
Should there be a mask mandate?
No, I don't think there needs to be a mask mandate. I think people understand now well enough how this infection spreads, that it's an airborne infection. And therefore, if you're either at risk or you are sick and you're coughing and you have a cold, the right thing to do is to wear a mask to protect others. So it's both to protect yourself and to protect others. And it should become a way of life now, I think. It should not be stigmatized. It shouldn't be only COVID. And people shouldn't look at each other strangely if you're wearing a mask. Right now, a minority of people are wearing masks. But in many countries, the moment the winter season comes in and respiratory viruses increase, people automatically wear masks. The whole of East Asia, for example, you go to Japan, South Korea, everybody's walking around with a mask. It's not considered strange. You're protecting yourself and protecting others.
A final question, ma'am. Is it your belief that as we test more over the next couple of weeks, we will find this having substantially spread in India?
Well, yes, I think from the beginning we've seen this happen, right? The more you test for COVID or for any infection for that matter, the more you will find it. And this is why it's important to continue the testing and the surveillance and the genomic surveillance. And so that we can pick up when it's still at an early stage, we can assess the situation and the response measures can be, appropriately titrated. So wastewater surveillance is another great way of doing this. Some cities in India are doing wastewater surveillance. And if we put that in place on a regular basis, I think we will be forewarned of any impending surges because you can pick up the signal a week or 10 days before you start seeing the rise in cases.
A final question, which I didn't ask, I should have earlier on. The symptoms, ma'am, is there anything new or different? What do people need to look out for?
I think the symptoms are more or less the same from what I've read. So fever, cough, loss of smell, loss of taste, and of course then if you start getting persistent high fever, breathing difficulties, fatigue, inability to eat and vomit, those are some of the warning signs. A lot of people invested in having those small pulse oximeters at home. So again, if you're in a vulnerable age group, then testing oxygen saturation is a good way to. And then, of course, do the usual things like stay hydrated, take plenty of warm fluids, take paracetamol to keep the fever down, but then just keep an eye on the symptoms and get to the hospital if there are any of these warning signs.
Well, Dr. Soumya Swaminathan, thank you very much for once again, spreading basic education and science to our viewers, letting people know that it's time to be alert once again if they aren't already. But this is a bit of a worry. And I think the big takeaway for me is that, COVID cannot be considered as just another cough and cold. It's not. And we therefore do need to be alert, particularly those with comorbidities and those who are perhaps older or more vulnerable. Thank you very much, ma'am, for sharing those details with us.